there's just so much.
You're listening to a Mamma Mia podcast.
So it's the perimenopause that is actually, I think, the most difficult time for women. And in that time, what's generally happening is you're not regularly ovulating. And because you're not regularly ovulating, you're not making progesterone, but you tend to be high in estrogen. It's the erraticness and the unpredictability of what our bodies are doing in that time that makes it also difficult to understand. So it's in our 40s that this really starts to happen. But I think we also have to be mindful of the fact that for some people, it actually happens in their 20s and 30s. I've had teenagers who've been menopausal. I really do want to flag it with people out there that if you don't feel right in your body, you don't feel like your hormones are serving you, yes, you could be perimenopausal even in your 30s. It's not just 51.
Hello, welcome to Well, Your Full Body Health Check. I'm Claire Murphy.
And I'm Dr Mariam.
And today, you and I, Mariam, are going on a lifetime hormonal tour. Sounds like the worst Kentucky trip ever, right? But basically, we're getting to know our hormones from puberty to fertility, peri to postmenopausal. Basically, what we need to know about our hormones through all our different life stages, teens to queens. Mariam, how were you in puberty? Like, honestly, from your parents' perspective?
I think I was like the perfect child at all times. But when I look back, actually, I feel sad. I was that really awkward child. I was like the third daughter, middle child, 1 of 5. So I think I kind of got missed. And I felt really awkward and embarrassed about the changes in my body.
Did you try hiding?
Yeah, I did. I hid a lot of things. And although I had older sisters, I was just really uncomfortable in my body. And then the mood swings happened as well. And I think I felt very isolated. No one had really spoken to me about what to expect or how to deal with it. So, yeah, I feel sad when I look back and think of puberty.
Yeah. I think I was overlooked a little bit too, but only because I was the baby by such a long way because my brother and sister are so much older. I don't think people wanted to see me as going through puberty. They wanted to keep me as the little one.
Yeah.
And so no one really talked to me either. I just kind of had to find it out from Dolly magazine and other things. But yeah, I was a wretch when I hit teenagehood. Like the hormones were really quite significant in, you know, my day-to-day moods, and my skin was awful. And it was just like.
Were you more on the bitchy side or?
I think so.
Yeah.
I was really mean to my sister, but she had always been really mean to me.
Yeah.
So I feel like it was kind of payback.
Yeah.
I don't know, but I gave my mum and dad a fair bit of hell too.
I think I was more on like the sad side more than the bitchy side.
No, I was very bitchy and awful. Okay, so let's take us back to preteen us. So for the few years leading up to this, your adrenal glands that hang out just above your kidneys.
Oh, they're so cute.
They apparently are cute. I've never seen them, but you've said this before. They have been sort of quietly ramping up production of androgens, so hormones like DHEA and DHEAS. And they're telling your body to start doing things like growing hair down there and under there. And it also contributes to acne, which from my perspective has, I don't know, 0 evolutionary purposes, but there you go. Up until this point, your hypothalamus has been set to do not disturb. So it's snoozing, waiting for the moment that it's going to wake up and get to work. Until it does, it keeps a lid on those hormones. They're the hormones that trigger growth into adulthood, but one day she stirs. At first, mostly at night, the hypothalamus sends tiny little rhythmic signals, pulses of a hormone called GnRH. I'm going to attempt to say this.
Gonadotropin releasing hormone.
Well, you can say it for me. Perfect. It will eventually start doing it during the day too, and this is what marks the official start of puberty. Now, those little GnRH pulses travel to the pituitary gland, that little pea-sized structure.
That's really cute as well.
Base of her brain. I don't know what your definition of cute is. I need to go and Google that. And it will respond by releasing 2 new messengers into her system, which is LH, which is
luteinizing hormone,
and FSH,
follicle stimulating hormone.
Thank God you're here because that felt like way too much for me to say. Those hormones then hurtle on down to the ovaries who have just been kind of sitting there waiting for their time to shine because LH and FSH spark off her estrogen production. So they start to crank out estradiol and begin reshaping pretty much every system across her entire body. Boobs begin to grow and form ducts. The uterus and vagina prepare themselves for menstruation. She gains height and bone until eventually it closes the growth plates and then you are as tall as you are ever going to be.
Yep. Unless you do that crazy surgery.
Oh, the bone lengthening surgery.
Yeah, that's nuts. Anyway,
That's
that's a conversation for another day.
Indeed.
Yeah.
When menstruation finally arrives, a year or two after this process begins, usually it's called menarche, which sounds wild. Like,
but why is there a man in there? I just hate that.
Oh, there's a man in everything.
Yeah.
But it feels like you're going to take to the streets dressed in like black leather and holding weapons, menarche. Science shows you probably don't ovulate for several of those first cycles that you have. That doesn't necessarily mean that you don't, but you most probably don't. Not until your body figures out how to period, and then the system matures into a full-blown egg factory.
Yep.
And each month it creates like, I don't know, however many it decides to chuck into the potential egg pool, and then one of those, generally, sometimes more than one, gets like shot out of a cannon.
Yeah.
into your fallopian tube. And that is a story of how hormones wake up and literally take over our entire lives.
It's like beautiful. If
It's
you think
gorgeous.
about it, it's like magic and mayhem all at once. You know, your brain's firing off new hormones, your ovaries are waking up, your bones are stretching, then your mood starts swinging and your skin's staging like, what the fuck is happening?
I remember getting this pimple, and I still think about it to this day.
Yeah.
It was like under my eye and sort of across from my nose, and it was so big.
Yeah.
Like, you know, that hot
and
lump, hard, inflamed,
Yeah.
like, and it was just so on my face
Yeah.
that I think I tried to use Dettol to clear it off.
Yeah.
And then, of course, the Dettol burnt my face because I didn't water it down like you're supposed to.
My dad used to give us methylated spirits. I'm like, that's not how you deal with it.
Wow.
It's like-
Metho straight to the face.
I had these like chin pustular ones, but they were so fun to pop. Don't do that. But like as an
No.
adolescent, it was like,
I know. It's satisfying.
it's so satisfying.
really bad
Now
for
I
you,
just
don't
watch Pimple Popper.
Yeah, that's very satisfying. But yeah, what an incredible system we have
Yep.
in order for us to start this idea that one day maybe we will procreate.
Yeah,
It's incredible.
It is incredible.
So next, we're talking to 3 experts who'll take us on our hormonal magical mystery tour. First up, Dr Ginny Foo. She's an obstetrician, gynaecologist and fertility specialist who specialises in treating adolescents. So think back to when you first, sat down on the toilet or were just walking along at school minding your own damn business and saw that blood for the first time. Or maybe someone even pointed it out to you, which seemed like the most horrifying thing to ever happen to you ever in your lifetime, even though it absolutely shouldn't be like that. Maybe you were like 12 or younger and wondering what was happening to you. And so that is where I started by asking Dr. Foo why girls seem to be kicking off periods a little earlier these days.
Want to feel good more often in 2026? Hi, we're here for you. Move by Mamma Mia helps you fit movement into your everyday, giving you more of me time whenever you need it. From strength and cardio to yoga and Pilates, with workout plans that fit every space, every body, and whether you've got 10 minutes or 40. Start 2026 with enjoyable movement from just $9.99 a month. Mamma Mia subscribers get unlimited access. Head to move.mamamia.com.au and use MoveMe to get $20 off an annual subscription.
All right, let's try and tame this roller coaster, shall we? First, what factors are going into waking up puberty hormones a little earlier? Young girls are getting their period seemingly younger and younger now, around 8 or 9. Do we understand that any better at the moment?
No, generally speaking, the average age of having a period is between 11 and 13. Obviously, there is spectrums to everything. Anyone before the age of 9 to 10 years old will be considered very early. And if girls are not coping with it, there are medical ways to potentially stop those hormones to try to help them ease into it, especially if the family's not coping for it for a variety of reasons. If the child is coping with it, then that is completely fine. That is completely within what we call the normal spectrum of having your periods. So it's not that the periods are actually coming earlier. I think it's what is normal, right? I think we are more aware of things or when they should be happening, and we have to figure out what is normal and not normal. So I always say to parents, if you're not certain, it's worth to see up to your GP or your family doctors to figure out what's normal, and they can guide you along the ways there around if help is required.
The next step in the period process is understanding what level of pain is normal. If there is pain from the very start of her period, is that a sign there's a hormonal problem? And when should you be asking your doctor for help?
I always say that no one can take pain away completely, but it's about making it manageable. So if you feel your pain is not manageable, then that is not normal. What's normal for you is not normal for someone else. What's normal for me is not normal for you. So it's really about what you can manage normally. And if you feel that you're not managing because you're missing school, you're missing your hobbies that you love. And if you say, for example, you're playing netball at a really high level and you just can't get to your training because of your periods, then that is not normal. And I always say to a lot of my patients that I can't take pain away for you completely, but it's about making your life manageable and that you can lead your day-to-day life of what you love, do what you love best, and do what you're good at from a day-to-day.
Why is it that some of us end up with serious PMS or PMDD and some don't? Is that a sign of higher levels of hormone fluctuations? Do we understand what causes that?
We don't really know exactly why. PMS happens in about 95% of girls or women, and that is very normal. So literally, if you're PMS and you are in that 95% of people who are actually having normal symptoms of what is actually going on. But it's the degree of the PMS that actually changes things, I would say. And everyone presents their PMS in different ways. Some people get a bit more emotional. Some people start crying in front of TV. Some people get a bit more angry. And sometimes it's also about knowing yourself and really going, hey, actually my period's coming. This is why I'm feeling this. And then people work with what they're feeling, realizing that where things are happening. There's a lot of different period apps nowadays. And I actually do encourage a lot of my young girls to say, hey, it is important just to track it down. And then sometimes you work out and say, actually, my period's coming. This is why I'm feeling this. This is why I'm feeling anxious, and working it out, because nothing beats having a diary.
What impact does birth control actually have on our hormones? My friends are always concerned if they come off it that their hormones might have, somehow forgotten how to hormone, or it's had some long-term impact on their fertility. What's it doing to our hormones? Can it have long-term implications?
So the studies have shown that actually there is no impact in terms of the pill on fertility, okay, unless you have already a predisposition to having a fertility issue. And that's a different story altogether. But the pill itself has not shown to have any impact on fertility. What does it do to our hormones? It has both estrogen and progesterone every day. Well, what happens in your normal period is you have more estrogen in the first part of your period. So from the first day of your bleeding or just after you finish your bleeding to when you ovulate. And then the second half of your period, you have more progesterone. While when you're on the oral contraceptive pill, to prevent ovulation, you have estrogen and progesterone through the month.
When would things like endo or PCOS start to raise their ugly little heads in these first few years after you start menstruating? Do they tend to appear early on, or do they take time to kick in? How does it work?
Yes. So, there are girls who first present very early on and have PCOS at the age, for example, if they haven't had a period until they're about 15, 16 years old. And then that's when we can potentially diagnose if it's very, very obvious. PCOS is really a spectrum of one syndrome, and they can present in many, many different ways. It takes a few years for us to see if things settle down. It's very common when you get your very first period at age of 11 to 13 that you're going to get irregular periods, bleeding with no ovulation and ovulatory bleeding. And so that is one of the markers of PCOS, together with the acne and the unusual hair growth of the male hormone. So most of the girls who have PCOS, if they had normal start time of their first period, take a few years before we can really diagnose it. In terms of endometriosis, it does also take a few years. A lot of girls who have endometriosis tend to present firstly with really bad period pain before they present with bowel changes. Obviously, there's a range of presentations with endometriosis. The gold standard of diagnosing endometriosis is a keyhole surgery. So it's a big step for a young girl at the age of 14, 15, for example, to say, I'll have a keyhole surgery, which are small little cuts on your tummy to have a look at what endometriosis is.
Mariam, it's interesting that Ginny has that perspective on girls getting their periods younger, that it's maybe not necessarily as big a thing as we think it is or have been told it is, because getting your period in that window 8 to 11 is actually pretty normal. Maybe we're just talking about it a bit more now.
So puberty for girls starts somewhere between 8 to 13 years of age. Average age in Australia is about 12 years of age. Before that, you've got other milestones to achieve, which we brushed upon, like the breast budding, and then you've got the pubic hair and the underarm hair growth, and your period should come a year to 2 after that. But when we talk about girls getting their periods in the 8 to 11 range, that actually still sits within the normal age of puberty. And she's right, it's not necessarily getting earlier, but research does show that there's a gradual global shift with more girls reaching puberty at the younger range of that age group. And in Australia, about 12% of girls will start their periods between 8 to 11, which is a good number.
Yeah.
And scientists behind the research say it's likely due to a mix of environmental and social factors. And the one that they highlight in particular is childhood obesity. And as obesity rates rise, so too has early onset puberty, though they're careful to say it's a connection, not cause and effect.
Right.
And this matters because the timing of your first period isn't just a milestone, it's linked to long-term health issues, with some people saying that's associated with a high risk of certain conditions later in life, for instance, heart disease and some cancers, for instance. On the flip side, late periods can be linked to an increased risk of bone fractures, which Ginny touched on as well. So while having your first period at aged 8 to 11 can still be normal, it's also a reminder that our environment, our nutrition, and overall health play a really powerful role in how and when puberty unfolds.
Yeah, God, nutrition is such a tough one that we've touched on quite a few times before, but food sometimes is working against us these days, so it's even harder than it used to be. Okay, so let's officially move on to hormones in our 30s and 40s. We're talking pregnancy, maybe one thing that'll happen to you in that time frame, so might perimenopause, and a whole bunch of other fun stuff. Dr Isabelle Smith is an endocrinologist, so someone who specialises in the diagnosis and treatment of disorders related to your hormones. We began our chat with her about whether by the time we hit our 30s and 40s, whether our periods and like other hormone-related systems, should have figured themselves out by now.
I would say that usually happens a little bit earlier. Most people's menstrual cycles start at around 12 to 15. Hormones in those teenage years and early 20s are often higher. And then we see from our mid-20s, our hormone levels do decrease a little bit. Our testosterone decreases a little bit. I would say by late 20s, early 30s, our menstrual cycle and the impact of our hormones should, I guess we could say, leveled out. But however, there's lots of people that have monthly problems from their hormones from PMS, or they have polycystic ovarian syndrome that are going to continue as they age and up until menopause. So yes, our menstrual cycles should have normalized, but what is normal will differ from individual to individual.
Now, what a lot of women might have done in this age window too, as we go from our late 20s into our 30s, is start their families. When you have a baby, we know that hormones start dumping in that we haven't experienced before, and it does take some time to sort of recover and come back from that afterwards. But how long generally does it take to get back to whatever your version of normal is, and how big are those hormone fluctuations during pregnancy?
It's a great question. I'm actually second trimester pregnant at the moment and definitely experiencing the high estrogen symptoms and boobs like I've never had before. And so in pregnancy, our reproductive hormones are really, really high, and they gradually kind of peak around the second trimester. And that's preparing the body for pregnancy and for breastfeeding. Then after the baby's born, a few days later, our hormone levels drop rapidly, and that's often referred to as the baby blues, which is different to postpartum depression, but it's that rapid drop in hormones to very low levels, almost what we see at menopause. And that's because of when breastfeeding starts. Breastfeeding and a hormone called prolactin that's involved in important for breastfeeding, it turns off the messages from the brain to the ovary to make hormones, whereas in pregnancy, the hormones are coming from the placenta. So after the baby's born, hormone levels drop, and it's usually not until breastfeeding decreases, especially those overnight feeds, that reproductive hormones, our menstrual cycle, comes back. Now, that can be a challenging few months as women readjust to having cycling hormones again in a regular menstrual cycle. Often it will be a few months. There might be a period a couple of months later, but definitely once breastfeeding has stopped, period should return. And if they haven't returned, it makes me worry. Is someone under fueling from breastfeeding? Are they trying to crash diet too much and their periods haven't returned due to another issue, which is the body's under stress from psychological and physical stress, often associated with underfueling. But yes, usually after breastfeeding is when we'd say periods should come back, and it takes a few months for things to get back to normal.
And sometimes we miss some of those fun hormone releases during pregnancy, like relaxin, which allows our joints and things to become a little bit more malleable to get prepared for pelvises opening and babies coming out. But others, joints also benefit from that. And sometimes you miss some of those pregnancy hormones afterwards.
Interestingly, PMS and premenstrual dysphoric disorder are, for some people, really, really significant. Some people even have their ovaries removed to manage this condition. Usually it gets better in pregnancy, which is fascinating because the hormone levels are quite high. And so for some women, they actually feel mentally really good in pregnancy. And there's resolution of some of those conditions, endometriosis, which is a little bit different, often also really well managed in pregnancy.
So we know, and we're being told quite consistently now, that by the time we hit our mid to late 30s, our egg reserves are starting to drop off quite a bit. How does that actually impact our hormone levels and how our bodies respond to that?
Our egg reserve is actually declining from birth. It's our egg quality that really declines from our mid-30s, which is why we see often it's harder, takes longer to get pregnant, and why women, even if they're having a regular menstrual cycle each month and ovulating, as they get older, especially after 40, it's really difficult to conceive. So there's two parts at play. One is egg reserve and how many eggs we have, and then egg quality, that is different. But in terms of egg reserve, there is a lot of individual variation. The average age of menopause when we completely run out of our eggs is 51. So that means for 50% of people that's younger, but for 50% of people that is older. We see around at least 1 in 20, so 5% of people have menopause from 40 to 45, and we classify that as early menopause. And from before 40, it's about 1 to 2%, what we call premature ovarian insufficiency. But definitely a lot of women towards their late 30s will start to have declining egg reserve, which is when we start to see those early perimenopause symptoms can happen. And it's hard because those early perimenopause symptoms are often not very specific. And when I say specific, it means that some of these symptoms don't just occur in perimenopause. I go through the Australian menopause symptom checklist with my patient, and some of them are you tired? Have you been feeling unloved? How's your mood been? And I go, well, I'm definitely not perimenopause, but I can tick off some of them. I'm seeing so many women in their late 30s and early 40s coming to me, could this be perimenopause? And it's usually more severe PMS and PMDD that we see gets worse as women age. It's very important that women track their menstrual cycle. Anyone who has a natural menstrual cycle, i.e. you're not on contraception, should track their cycle and try and work out, are their symptoms happening all of the time or are they only certain parts of the month? Because both PMDD, PMS can present quite similar to those early perimenopause changes before we've had any period irregularities.
Talk about estrogen and progesterone quite a bit when we're talking about women's hormones, but testosterone is a part of our hormone panel as well. And a lot of women now, especially on social media, are talking about testosterone and whether it should be included in hormone replacement therapy, but also in relation to declining libido and that maybe it could help in that department. So what do we know about testosterone and could we be using it to help our libidos that seem to do drop off at this time?
It's a great question, and it's a very controversial question in the world of menopause and the research and evidence. But yes, our testosterone declines from our early 20s and it continues to decline. Interestingly, it does not rapidly decline at menopause. That is a misunderstanding, and we have very good data, especially a study just published recently by Sue Davis where they measure testosterone levels very accurately, with a form called mass spectrometry. And we see testosterone levels gradually decline from 20s through perimenopause, menopause. And interestingly, they actually increase at about our late 60s, early 70s, which is, we say women get a lot of facial hair as they get older. And yes, testosterone is an important part of libido. And I chat with women all the time about libido. I normalize with my patients that in long-term relationships, it's not abnormal to be not that interested in sexual activity until it starts. And these are taboo topics and conversations that we don't have. And if we talk about them more freely, we realize these are very common things. And I talk about what makes a secure, safe relationship is predictability, familiar, security, and they are often quite different to the initial excitement of a new relationship. So we do have some treatments that may help, and testosterone, it is being lauded as the kind of cure-all for energy and mood, which the research doesn't really support. Of course, some women might get some extra benefits from testosterone. Yes, it is a tool in our toolbox for helping women with hormones and libido.
We might, in this age bracket, also be experiencing some pretty significant stresses, like our work. Maybe we've climbed the corporate ladder over the last decade or so and we're in a stressful position. Maybe other pressures, like especially with sandwich generations who find themselves taking care of kids and aging parents at the same time, as well as holding up the mental load at home. Can stress actually impact our hormones?
And this is such an important topic, Claire, because I see these women in my rooms all the time. And often they're wondering, is it my hormones? I feel so stressed and tired all this time. And I say, each thing that you're doing individually would be challenging. Teenage kids, the mental load of home. Unfortunately, even though women work full time, usually, we have a lot of research to show they still carry most of the mental load around the home. Then they have aging parents that they're often looking after. And as you say, a peak point in their career, change in relationship dynamics as the children age. And so that is huge. And there's only so much we can handle in our stress cup. And I validate women, even if there is or isn't perimenopause, your feelings are justified right now for being completely overwhelmed and stressed by the constant stress you're under. Can stress trigger hormonal conditions? Interestingly, so women are much more prone to autoimmune conditions, especially the thyroid. Normally, our immune system should be trained to recognize self-tissue versus foreign tissue, but it often gets confused and makes antibodies against our thyroid. And we can see, especially more acute psychological stressors, I see, such as like a bereavement or a major stressor, can trigger autoimmune diseases. I've seen Graves' disease, which is an autoimmune thyroid condition. Any illness, like a viral illness, can also trigger an autoimmune condition. Chronic stress and the impact on our health is a complex topic because it is very hard to study. But yes, definitely stress does play havoc in our physical health.
Mention Graves there. Is it true that women are more susceptible to thyroid-related conditions in this age window?
Oh, several times more. So Graves' disease is an autoimmune condition of antibodies that act on the thyroid and cause it to produce excess hormones. And it is far more common in women, and often women of that kind of 40 to 60-year-old age group. Kind of has two peaks in early 20s and then again at that kind of age range. And yes, Graves is very common. I see that all the time in my rooms. It is a good example of when we're feeling stressed, we should go and see our GP that we hopefully have a rapport and a therapeutic relationship with, and they can test for medical conditions that could be contributing to how you're feeling. Yes, Graves, hypo and hypothyroidism, very common.
What about the impact on things like anxiety and depression when we're in this kind of age where we are going through maybe extra stress and then potentially IVF and maybe pregnancy and also potentially perimenopause? There's a lot happening within your 30s and 40s. Can our hormonal shifts and fluctuations impact our mental health, anxiety, depression, things like that?
Oh, 100,000,000%. I work very closely with a lot of psychiatrists who refer patients to me. For example, is there more in the 30s age group? Usually it's more the PMS and the PMDD. We are hearing so much about perimenopause, but to be honest, it is still quite uncommon in 30s. But PMS and PMDD, if we think our reproductive hormones, so estrogen, progesterone, testosterone, mainly for women, estrogen, progesterone, but they are what we call neurosex steroids. They impact all of our neurotransmitter production. They act on our brain. For example, progesterone, all of its metabolites influence our kind of GABA neurotransmitters. So yes, our reproductive hormones definitely can impact our mood. And we might see women who we know at perimenopause, for example, people are much more likely to get depression for the first time and then have recurrence of previous depression. If they've had postnatal depression, that's also a risk factor for depression at perimenopause. And then PMS and PMDD, for women, for example, who might have bipolar affective disorder or depression, they may be quite well managed previously, but as they are getting older, the impact of their menstrual cycle hormones are kind of exacerbating those conditions. The same for ADHD. That is also a common period where maybe women had been able to, we talk about masking symptoms of ADHD. Often when they are having, moving towards that perimenopause, that's when things start to come undone, and their ADHD and how it impacts them might have a much greater impact on their life, being exacerbated by those hormonal changes.
I thought it was so interesting how Dr. Smith said that we still have agency when it comes to our health. She's so right, because we've been told now that the conversation around perimenopause has grown considerably louder in the last 10 years or so, that we're kind of at the mercy of that and there's not much we can do about it, but we can make excellent decisions about our own health and healthcare every single day that do have significant impact, whether it's lifestyle changes or whether it's just being kinder to ourselves or whatever it might be. Like, we are in charge of our bodies. Our hormones don't run the whole show.
Exactly. And I think it's fantastic on one hand that we're finally openly talking about hormones. You know, for decades we've dismissed having these conversations. So it's great we're having that platform. But I thought it was also important that she mentioned, on the other hand, the narrative has been so co-opted by marketing.
Yeah.
It's often misleading and it's disempowering as well. So we absolutely deserve as females to understand our hormonal health, but that knowledge should give us agency, not take it away.
In a sec, we're heading over to the Over 50s Club where we're all just trying to count the days till that 12 months of no more periods hits.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like, it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Oh, hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12. Look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
Okay, we are over 50 now
in
our hormone discussion. And this is when most of us will hit menopause for reals. Perimenopause is that fun lead up around a decade.
Period of chaos.
The window of chaos I've heard it referred to, yes. This is when our periods will stop. Hallelujah. Although for stacks of my friends, they would have no idea whether their period has stopped or not because they might have an IUD or they skip the pill or have other contraceptives that don't have a period. So is it actually important though? I'd love to get your take on this. When we're in that stage of life, if you haven't been having a period and you aren't going to have one into the near future, is it important to know when you've actually hit menopause and that your period has actually stopped?
Okay, so this is a great question. I have so much to say about this because there's
Strap yourselves in.
Yeah, there's so much stuff online. So knowing whether you've reached menopause helps you and your doctor make some really important decisions about your health. So it's not just about your period stopping. We know menopause affects multiple systems like your heart health, your bone, your metabolism, your mood, and even your sleep. And it can help guide decisions that are really important as well, like, can I safely stop contraception? Should I be thinking about hormonal therapy if I haven't started it in the perimenopausal group? Is it time for a bone density scan or a heart check, for instance, as well? So when we define menopause, we say it's diagnosed after 12 consecutive months after your last period. That's a natural period.
My friend just went 11 months and then got her period again.
That's
She's so pissed off.
It's like, haha, got you.
Damn you.
And that means no hormonal contraception masking your cycle. So what if you're on contraception that stops or changes your bleeding patterns? That's where it gets really tricky. So if you're on hormonal contraception like the pill, the hormonal IUD, the intrauterine device, or the implant, you might not bleed at all or you might have irregular bleeding patterns. But here's the key. Bleeding on contraception, I'll just fix this, is that it's not a natural period. It's a withdrawal bleed from the hormone. So you can't use that 12 months without a period approach while you're still on contraception. So that doesn't apply. What about hormonal tests? So that's a great question that people often ask. Sometimes they can help, but they have caveats. So if you're on progesterone-only methods, so that's contraception that only uses progesterone, like the IUD, there's progesterone-only pills, like the mini pill, your doctor may be able to check an FSH level, but results can vary. And we need to take serial measurements several weeks apart before we can confirm menopause. But if you're on combined hormonal contraception, like the pill, the patch, or the ring, these hormonal tests aren't reliable because the hormones in these contraception will suppress your natural cycle.
Okay.
If you really, really want to know where your body's at, and I get a lot of females come into my clinic and they just like, I want to know if I'm postmenopausal, the best way to do it is a washout period. So we stop hormonal contraception if it's safe to do so, and we wait about 3 months for your natural cycle to reveal itself, and then we review your symptoms and possibly your hormone levels, and then we have to do like a serial measurement a couple weeks later. Otherwise, general guidance is keep using your contraception until at least age 51 or 12 months after your last natural period if you're over 50, or 24 months if the last period was before the age of 50. In reality, your doctor will look at the whole picture. So it's your age, it's your symptoms. Symptoms are a big part of diagnosis, the hot flushes, night sweats, mood, sleep changes, all those sorts of things, and your type of contraception rather than relying on a single hormonal test. And if you're under 50, remember there's still a chance of ovulation until menopause is confirmed. Many females can still get pregnant, so that's why contraception is a really important part of the conversation. So my advice is, I know I've said so much, but my advice is have an open chat with your GP. Be clear about what contraception you're using, your age, your symptoms, and whether fertility is still a consideration. If confirming menopause is really important for you, then your doctor might suggest pausing or switching contraception to safely observe your natural cycle. And even if we can't confirm it straight away, your symptoms are real and there's so much we can do to support you through perimenopause as well and beyond. Yeah.
A lot to consider, but we have quite a few questions to ask of Dr Natasha Andreas about hormones over 50, what kinds of things we need to be more across at this time in our lives. Dr Natasha Andreas is a gynaecologist and fertility specialist. I started off asking her about what exactly is happening to our hormones, and I don't just mean the main offenders, estrogen and progesterone, but lots of other things once we hit our 50s.
So when we hit our 50s, we are considered perimenopausal, if not menopausal, and hormones in our body in total will change. So it's not just ovarian hormones that are in flux, progesterone and estrogen. It's also hormones that speak to our ovaries, FSH and LH, that change. Other things like melatonin, which is considered a hormone, also changes, and that also is made by our brain that then impacts our sleep, etc. So things like insulin, which is considered a hormone, also is more likely to become an issue. So around 50, our bodies start changing. And it's a real concern for many women because they don't really know what's happening. They really struggle with the changes in their bodies. And often it's because they don't know what's happening. They're not prepared. But look, having said that, I am a person who's 51 and I'm going through the perimenopause at the moment. And I know a lot about the menopause, right? A lot. But I am also kind of quite surprised at how my hormonal flux is impacting me as well. So it is a time for change, a time where women really need to be taken aside and given a lot of attention.
Can we address menopause first? Because perimenopause can start up to 10 years beforehand, so you might have traversed a fair bit of that through your 40s as well. But the average age for women, Australian women, to hit menopause is around 51. What then? Because I think in my brain I thought once you hit menopause, like that's it. You don't have to deal with all of that roller coaster anymore. So what is actually happening and what are we dealing with once that period has stopped for 12 months?
Well, the roller coaster really is the perimenopause. So it's when those hormonal fluctuations are occurring, when we're still having the occasional period here and there. I find it's when women are in the menopause per se, when they haven't had a period for a good year or a couple of years, that things really settle. So it's the perimenopause that is actually, I think, the most difficult time for women. And in that time, what's generally happening is you're not regularly ovulating. And because you're not regularly ovulating, you're not making progesterone, but you tend to be high in estrogen. And when you're high in estrogen, then you're more likely to have heavier periods, issues with mood, breast tenderness, weight gain. The low progesterone means you tend to have, again, issues with mood, but also issues with sleep, etc. And that fluctuates because some months we ovulate and other months we don't. And when we ovulate, we make some progesterone. Overall, in that month, we might be feeling a little bit better. But it's the erraticness and the unpredictability of what our bodies are doing in that time that makes it also difficult to understand and to handle. So it's in that decade, it's in our 40s that this really starts to happen. But I think we also have to be mindful of the fact that for some people, it actually happens in their 20s and 30s. You know, I've had teenagers who've been menopausal. So we can't forget about those women either, you know. So I really do want to flag it with people out there that if you don't feel right in your body, you don't feel like your hormones are serving you, yes, you could be perimenopausal even in your 30s. It's not just 51. So we kind of need to move that needle, I feel.
I think that's the thing with hormones is it is a different story for pretty much everyone. And even if you are, say you and the woman next to you are both in a state of low progesterone and high estrogen, your symptoms may not necessarily be the same because hormones have different impacts on different people depending on so many different factors. So I guess it's very much an individual journey, this perimenopausal, menopausal period.
Like any single medical condition out there, any life change, you know, some kids go through puberty better than others or easier than others. The same applies with the menopause or even pregnancy. You know, that's a huge hormonal challenge to the body. Some women cruise through pregnancy, love pregnancy, want to do it again. Other women are like, no, thanks, don't want to do that again.
Yeah.
Yes, it's an interesting time, but I actually think it should be also a positive time. It's a time for women to reframe, to kind of go, okay, I've hit 50 now. Now's a time to review my life, to review my habits and everything around me.
Well, can we have a look at what some other hormonal changes might be causing? So I have been reading about the hormonal impact on things like heart health and cholesterol. What's happening in our 50s to cause issues like that?
Yeah, so estrogen's role before menopause. So obviously before menopause, estrogen, it provides us with cardiovascular protection. It helps maintain healthy cholesterol by increasing what we call HDL, which is the good cholesterol, lowers the LDL, which is the bad cholesterol, and the total cholesterol. And estrogen promotes flexibility in the blood vessels, so it supports the smooth blood flow. It is also anti-inflammatory. Okay, so estrogen reduces inflammation in blood vessels and it decreases plaque buildup. And what changes during the menopause is that as estrogen levels fall, these protective effects diminish. The body then experiences an increase in LDL cholesterol, which then contributes to plaque in arteries, decrease in HDL cholesterol, which reduces the body's ability to clear the bad cholesterol. Then you get a rise in triglycerides in some women, which adds then further to the cardiovascular risk. You then get high blood pressure, arterial stiffness. So then you're more likely to get the arterial hardening, what we call the atherosclerosis, the coronary artery disease, the heart attack and the stroke. And then other contributing factors are, of course, weight gain, especially around the abdomen, that really women don't like. And, of course, nobody likes that. I mean, even me personally, I've had a really tiny waist all my life. And suddenly I'm thinking, oh, my God, where's this coming from? What is this, you know? And changes in insulin sensitivity, because estrogen enables the body to be more sensitive to insulin. And then you get a high rise in type 2 diabetes. And then, of course, depending on where you are in life, sometimes we get busier. We're looking after kids, running around after aging parents, etc. You might have reduced physical activity. And we can't forget the ultimate hormone, which is cortisol, which is the stress hormone. Okay, so I say to people, before we even talk about estrogen or progesterone or testosterone or insulin, what are your stress levels? Where is your cortisol? Because if you are stressed, chronically stressed, you will have insulin resistance and you will have difficulties losing weight. And we can't just blame it on the ovaries and what they're doing. Cortisol is the grand conductor, I see. And so I implore people to look at their stress. And it's as simple as going back to is, how do you deal with a stressful day? Are you breathing through your nose or through your mouth? If you're a mouth breather, you need to get that checked out because that's not good for you, mouth breathing, and that could be a whole other discussion. So managing heart health after menopause, okay, yes, it's diet. And I wanted to point out this new book that's come out. It's called It's Not You, It's Perimenopause, Sarah Gray. I started flicking through it. Sarah Gray is not just a nutritionist, but she's also a pharmacist. And this is a great book. I think everyone should get their hands on this little one. But she goes into diet, you know, emphasizing things like the importance of protein, fiber, omega-3s, the limited saturated fats, of course, exercise, regular checkups are part of managing the menopause, you know, lifestyle, we've talked about that, and, of course, menopausal hormone therapy. So cardiovascular risks, obviously, are very personal, depends on your genetics. So if people don't know their family history, they should dig into it a little bit more, because this is when it really starts to potentially impact us when we're in the midlife.
Well, you mentioned MHT or HRT, as most people probably still refer to it as. A lot of women are now starting to access it where they hadn't a generation before. And they're doing so through the perimenopausal stages, so in their mid to late 40s and onwards. But when you actually hit menopause, when you stop having a period and you're officially menopausal or postmenopausal, do you continue on with MHT, and for how long? Is that an individual thing as well?
Very individual. There is this well-known hypothesis called the window of opportunity, and that impacts the timing is crucial. And research like the Women's Health Initiative reanalysis suggested that MHT, menopausal hormone therapy, has heart benefits when it begins within the first 10 years of the onset of menopause or before the age of 60, because this might reduce coronary heart disease and improve vascular health. If it started later, say after 10 years of the last period or after the age of 60, it may increase cardiovascular risk because arteries may already have that plaque and that reduced elasticity. But I do want to emphasize that this is a very personal thing, and that people should see their cardiologist and their menopausal hormone GP or their specialist, because I have had women continue on with the HRT beyond the age of 60 because, you know what? They don't want to be getting those hot flushes and night sweats. They do have osteopenia and they don't want to develop osteoporosis and have a fracture. So it's a very personal thing that, and ultimately the patient needs to make that choice and that decision. Of course, it needs to be informed. So I say to people, read as much as you can on this. And this is where it can get overwhelming, you know. I get overwhelmed by all the stuff that's on social media.
Me too.
And then we've got to look at, okay, who are you following on social media? Follow doctors, follow people who have experience, who know what they're talking about, okay? Don't just go by what any social media influencer says. And that's where the noise comes into it.
What sort of health checks or blood tests, for example, are worth doing once we hit our 50s when it comes to hormones? Because we've been told now that checking your hormone levels throughout perimenopause isn't necessary to be diagnosed, but also doesn't tell you the whole story because you don't know at what stage of that window of chaos you might be in on any given day. But are there blood tests to check for hormonal related things worth doing when you hit this time in your life?
Yeah, look, sometimes, and I often check hormones depending on the situation. If it's not very clear, for example, if someone's in their late 30s and they're presenting with menopausal symptoms, you will definitely do hormones then. You would do the FSH, LH, estradiol. But yes, overwhelmingly general blood work, looking at a snapshot of overall health include, routine tests, a blood count, kidney function, liver function, fasting glucose, what we call an HbA1c to look for diabetes or insulin resistance, lipids, cholesterol, thyroid function. Yes, you could check the FSH, the LH estradiol we mentioned earlier, testosterone, DHEAS, vitamin D, calcium, phosphate. And then you've got your specific tests related to cardiometabolic vascular health, so their blood pressure check. Palpitations are hugely common in the menopause, palpitations. And that can be freaky for some women if they've never experienced them before. And so women sometimes do need to have a resting ECG or coronary calcium scoring if they have a family history or a high risk of cardiovascular events. Visceral fat rises with the menopause, so a body composition scan might be useful to assess waist to hip ratio, CRP, which is an inflammatory marker. Then, of course, you've got your bone and joint health, so your bone scan, your DEXA scan to assess fracture risk. And then, of course, there's cancer screening. So mammogram every 2 years from the age of 50 to 74. Generally speaking, there's a cervical screening in Australia. It's every 5 years until the age of 74. And you've got your bowel cancer screening every 2 years from the age of 50. For some people, obviously earlier if there's a family history. Skin checks, don't forget your skin checks, melanoma, and pelvic ultrasounds as needed. Then, of course, you've got screening for cognitive issues, potentially emotional health. So I often do a score in my rooms if I'm thinking, is someone depressed? Are they anxious? Or is the menopause? And there is a questionnaire you can do for that. And then, hearing can go, our vision, getting your eyes checked, dental, with lack of estrogen, you're more likely to develop inflammatory gum disease. You're more likely to lose your teeth. If you go onto certain medications for bone health, we call the bisphosphonates, then dental health is extremely important. So yeah, again, there's lots of tick box tests.
There's obviously so much happening from your first period to your very last and then beyond that. We go through so many transitions in our life hormonally, but we hope that this episode has given you some idea of what to expect when those things are either coming your way or you're right smack bang in the middle of them, and maybe how to prepare a little bit better for when those changes happen coming at you from down the line. On the way next week, we have a really special guest. She is from the UK. She's an advocate. She's an activist. She's a beauty influencer. She has been on the cover of magazines. She's walked catwalks. And she also has a full beard. Hanum Kaur has PCOS, and she's embraced one of the symptoms of that disorder, which is abnormal hair growth. And it is at the same time both the most and least interesting thing about her. She is such an incredible human being, and she was really open and honest with us about her diagnosis, about her symptoms, and about the struggle it is to be a woman out in the world with facial hair. That's coming your way next week. We'll catch you for your appointment then. This podcast is intended for general information only and does not constitute medical advice. Health information is not one size fits all, so if you do have questions about your symptoms, treatment, contraception, or fertility, please speak with your GP or other qualified health professional. Well is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach, video production by Julian Rosario, and social production by Ellie Moore. Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.